teens rarely know what they're buying, with the FDA seizing over 78.4 million fentanyl-laced pills and an additional 12,000 pounds of fentanyl in the year 2023 alone.
Many chemicals produced in cells are not as authentic as one might think, rather being pumped with other chemicals to make them feel better.
Started an epidemic of fentanyl-related deaths, with the target audience being young adolescents and teens. Unfortunately, the number of deaths relating to fentanyl has doubled and tripled over recent years. Unfortunately, the number of deaths relating to fentanyl has become the third biggest cause of deaths in adolescents, and there seems to be no cure.
Unfortunately, existing educational programs do not target young adults, with teens stating it to be ineffective and pointless. Some even stated that it caused them to start taking drugs due to their curiosity about the effects. Existing education programs are not effective, acting as a get-it-done activity for students. With the lack of interactive curriculum and impactful connection, there's a growing divide amongst teens and teachers.
To solve this problem, we created a 3-step plan centered around building connection between 3 key groups: students, parents, and professionals. By initiating this plan, we hope to break the barriers that separate these groups in order to build a community that fosters support and care. The first step in connecting the 3 key groups of students, professionals, and parents was ensuring that our students were very necessarily educated. This was done through a 2-week intensive collaborational course with the Forsyth Virtual Academy. In this course, we plan on educating all of the students with a 2-week course focused on 1, introducing fentanyl through understanding the drug, and then 2, moving on to prevention and intervention strategies. Throughout the entire curriculum, we made sure to include informational slides such as these that would allow our students to get a real perspective on the abuses of drugs such as fentanyl. We also included very many videos such as Alex's story that included a real-life perspective on the bad impact of fentanyl and fake pills on students and their lives. We also made sure to include interactive activities that would separate us from past curriculums, in which we would simulate what real drug stories were like and how our students can learn the dangers, potency, and negative effects, which would all allow them to say no to drugs. We included other videos and seminars such as the Forsyth County Drug Awareness Council Summit, in which students could truly understand the impact that drugs had on people's lives as such as these. These were all extremely important in ensuring that our students had the best educational experience. We also made sure to leave an impact on our students by creating virtual seminars in which students could join virtually in order to hear about more drug prevention strategies, as well as our own guest speakers in which we would bring to these meetings to ensure that all of our students truly learn the potency and negative effects of drugs while understanding how they can help their peers.
As well as our education initiative, we also have our website, which outlines our projects from start to finish. With this, we have a Learn, About, and Context page, where the Learn is a brief description on our education initiative. Most importantly is our blog, where we have multiple blog posts where users can interact with other users under these things, liking and commenting. Next, onto our app. We also have our drug tracking app, which allows users to interact with other users and track how many days they've stayed sober. Now, onto Sean.
The last step in our initiative was to create a youth council in which we could connect with other like-minded, passionate individuals in our community to inspire change and advocacy for more fentanyl. Through this council, we were able to also send emails to other professionals and advocates, such as legislators and state government officials, to ensure change was actually being enforced. Thank you.